Nicola Sturgeon has been attacked after a report found more than 100 people who had tested positive for COVID-19 were discharged from hospitals into care homes without first receiving a negative test. A total of 113 people were moved between the 1st of March and the 31st of May, although they had not received a negative test before they were transferred. The Public Health Scotland study shows a further 243 who had tested positive were discharged after at least one negative follow-up test. The report found between the 1st of March and the 21st of April there were 3,599 discharges from hospitals to care homes, with the majority, 81.9%, not tested for coronavirus. Of the 650 who were tested, 78 received a positive result while in hospital, and of these patients, 10 tested negative before they were discharged while the remainder did not. LBC presenter Nick Ferrari has erupted at the Scottish First Minster following the report. Speaking on his LBC show, he said, "It was strange, wasn't it, that the explanation Nicola Sturgeon gave was that she's not a clinician. Well, not many world leaders are clinicians. I'm sure there's possibly a couple around, but what you are of course is responsible for the decisions taken under the government that you run. While you can't be at everybody's bedside doing all the tests, it does ultimately track back to you. In Ms. Sturgeon's case, we have someone who has really sought to identify with the crisis. She has taken those daily press briefings, has tried to play politics and wrong-foot Westminster on times and appear more in control than Boris Johnson. Really, the chicken has come home to roost in this report. Simply saying, 'I'm not a doctor' isn't enough." Ms. Sturgeon said the report concludes that allowing for other factors, such as the size of a care home, hospital discharges were not found to have contributed to a significantly higher risk of an outbreak. She added, "Nothing in it detracts from the tragedy of the deaths that have occurred in care homes over the course of the pandemic, and nothing ever will detract from the heartbreak of those bereaved." The report noted that on the 21st of April, Health Secretary Jean Freeman said COVID-19 patients being discharged from hospitals to care homes should have given 2 negative tests before being moved. The report said that in the statistical modeling, hospital discharge is associated with an increased risk of an outbreak when considered on its own, but care home size is much more strongly associated with risk of an outbreak than hospital discharge. It states, after accounting for care home size and other care home characteristics, the estimated risk of hospital discharge reduces and is not statistically significant. Ms. Sturgeon said Public Health Scotland will now carry out further work to give a more detailed understanding of COVID-19 outbreaks in care homes. She pledged, "Where the report's conclusions highlight the need for additional measures, we will act on that. I want people to know we take this very seriously."